Hi everyone, this is Dr. Robin Murphy and I'm coming to you today from ACE Sports Clinic. So I wanted to talk a little bit about inflammation. From an acute standpoint, inflammation is adventitious. We want the immune system to induce the inflammatory response to help with injuries, to remove pathogens or infections, or really it's chronic injuries that we want to, chronic inflammation that we really want to address. And essentially, this is what's deemed as the silent killer, where individuals who are prone to chronic inflammation, it kind of goes unnoticed for decades. And this can lead to chronic disease, such as cardiovascular disease, even type 2 diabetes, and even certain cancers. So I wanted to talk today a little bit about certain nutraceuticals as well as the genes that can influence your risk for chronic inflammation so that you can get properly tested and do a follow-up so that you're made aware of whether or not you have chronic inflammation. So essentially, I wanted to start out with omega-3 fatty acids. So omega-3s, they come from plant-based as well as animal-based sources. And essentially, our body converts it into active forms as an anti-inflammatory. But based on genetic variations, individuals may not be as efficient at converting the plant-based omegas into their active forms. So it's important for these individuals to get genetic testing or to understand their conversion, because they may need to increase dietary sources of omega-3 fatty acids or even use supplements. And why is this important? Well, individuals who have these risk factors, if they're consuming a low amount of omega-3 fatty acids, it can increase risk for metabolic syndrome. That's essentially high cholesterol, hypertension, abdominal obesity, as well for athletes. If you are overtraining or having a hard time recovering, then an increase in omega-3 fatty acids can be really beneficial to help with that recovery phase. So not feeling as much muscle soreness, as well as reducing risk for injuries as well. Another supplement that I use quite commonly in practice is curcumin. So curcumin, it comes from the root turmeric. This is a brightly orange color root, and it has been shown to have so many beneficial anti-inflammatory, antioxidant qualities, and it's one of the best known anti-inflammatories, I would say, in the industry. And what's interesting about this is it's been shown to be preventative for Alzheimer's disease. So this first came into world popular view when they were looking at research related to Alzheimer's disease and what countries had the lowest rates. And what they identified is, even though India has a very high prevalence of type 2 diabetes, which is associated with an increased risk of Alzheimer's, they had the lowest risk of Alzheimer's. And they attributed it to their diet. So a high anti-inflammatory diet full of certain root vegetables and spices, such as turmeric. So turmeric, it helps to increase wound healing, as well as been shown to reduce pain, swelling, and tenderness with individuals with arthritis. And what's interesting about curcumin is it actually turns on certain genes within our liver to help with antioxidation, as well as to improve bile production and release. And this is a way to help reduce cholesterol as well. And then the last part that I want to talk about has to do with your risk for chronic inflammation related to tendinopathies, so tendon-based injuries. Certain individuals will have genes related to inflammatory cytokines. They're called IL-6, tumor necrosis factor, as well as genes related to antioxidants. And these are really important for our exercise and recovery. And what we find is individuals with certain versions of these will have an increased risk for chronic inflammation, muscle soreness after exercise, as well if you're engaging in certain types of exercise, like endurance training for longer periods of time, then there's an increased risk for tendinopathies. So there's a few ways to counteract these risks. First of all, it has to do with the type of training that you're engaging in. So obviously, laying off the endurance type training so you're not exercising as long, or you're slowly increasing the intensity, duration, and frequency no more than 10%, so that your body has an ability to adjust to the increase in demand that you're asking it to do, essentially. And then finally, we look at using different supplements. So N-acetylcysteine, this is a very strong antioxidant that helps with muscle soreness and recovery without blunting the healing signaling and processes that occur, as well as curcumin can be used, and omega-3 fatty acids. So all of these are beneficial ways to address chronic inflammation, but what I would suggest to anyone listening and any patients is to get testing done, so genetic testing as well as some simple lab markers, just to see, do you have any underlying inflammation? And more importantly, this is just kind of a tidbit of information, but there's so many other factors that can contribute to long-term and chronic inflammation. So make sure to call the clinic, and if you're interested, book a 10-minute introductory call with myself to see if we would be a good fit. So take care, and thanks for listening, guys. Bye.